a CPAP machine versus an oral appliance. And I think everyone will probably agree the gold standard in most people's minds is a CPAP machine. And the way the CPAP works, it basically forces air past the obstruction. And as long as you wear it, you're oxygenated. The problem is 50% of the people or more that get prescribed a CPAP won't wear it. And the ones that do wear it wear an average of 3 to 4 hours a night. And most adults get up at night to go to the bathroom and they come back to bed and it's like, I'm not putting that thing back on. They go back to bed. So part of the night they get oxygen, the other part of the night they don't. The other option you have is an oral appliance. And the advantage of an oral appliance is you don't have to plug it in, you don't have hoses attached to it. It's a very small device, fits on your upper and lower teeth, and it puts your jaw in a forward position to open your airway. As opposed to defeating the obstruction, it prevents the obstruction. And so it's a slightly different approach, but it results in the same thing. It opens your airway and allows you to breathe. And what we find is that once you get used to wearing it, and there's a learning curve to wearing it, I won't mislead you, you have to get used to it. But once you get used to that, we find that probably about 80% of the people will wear it on a consistent basis every night. And when they get up to go to the bathroom, they don't have to take it out, they keep it in. And we have found that for mild to moderate sleep apnea, because of the compliance and because it actually works, that for a lot of those patients it actually works better than a CPAP just because they're going to wear it. That's the main treatment options you have is CPAP versus oral appliance. Both work, they work slightly differently. It's more of a compliance issue than anything else. And we find that the oral appliance is just much more convenient. And for our military family members and military people, they can't deploy with a CPAP machine. And so if they want to stay on active duty and they want to stay deployable, they have to have something to take with them. So an oral appliance is the ideal thing for them to throw in their rucksack and take wherever they're going with them. So those are your options, and we feel like the oral appliance, while it's a different mechanism, it's equally as effective for those reasons.